Ever had a nosebleed out of nowhere and panicked? This isn't unique to you. In this video, we're breaking down why nosebleeds happen, what they really mean, and how to stop them fast. All in simple, clear steps anyone can follow. Whether it's dry air, trauma, or something more serious, we've got you covered. Let's dive in and take control of nosebleeds once and for all. Let's start with a question that catches a lot of people off guard. Why do nosebleeds happen in the first place? Sure, they look scary. Blood pouring from your nose can feel like something serious. But here's the truth. Most nosebleeds are not dangerous and can be handled easily at home. In fact, they're very common, especially in kids and in places where the air is dry, like during the winter or in heated indoor environments. So, what causes them? The top two culprits are dry air, which dries out and irritates the inside of your nose, making it more likely to bleed, and nose picking, especially in kids, which can damage tiny blood vessels inside the nose. Now, here's the good news. Most nosebleeds aren't serious at all. They just look worse than they are. The key is to stay calm and know what to do. With the right self-care, almost all nosebleeds stop on their own. No panic needed. Stick with me, and I'll walk you through exactly how to handle them, when to get help, and how to keep them from coming back. Most nosebleeds are harmless and stop on their own, but some can be a sign of something more serious, and it's important to know the warning signs. Here's when you should see a doctor or nurse immediately. First, if the bleeding is gushing or making it hard to breathe, that's an emergency. This isn't just a trickle. It's heavy bleeding that feels out of control. If you suddenly turn very pale, feel extremely tired, confused, or even lightheaded, your body may be reacting to blood loss. That's not something to ignore. What if the nosebleed just won't stop, even after you've tried all the self-care steps we'll cover in this video? That's another red flag. You should not be bleeding for more than 30 minutes as an adult, or 10 minutes for children. If the nosebleed happens right after nasal surgery, or if you know you have a tumor or growth inside your nose, get medical help right away. Bleeding in these cases may need professional treatment. What about other symptoms? If the nosebleed comes with chest pain, that's a serious concern and needs immediate attention. Or if you had a major injury, like a car accident or a hard hit to the face, the bleeding could be connected to internal trauma, and it's safer to let medical professionals handle it. Lastly, if you take blood thinners like warfarin, clopidogrel, or even daily aspirin, your blood doesn't clot as easily. So a minor nosebleed could turn into a more dangerous situation. Don't wait too long to get help. And here's the bottom line. If you're bleeding heavily, feel faint, or have chest pain, call 911 immediately. Don't drive yourself, and don't ask a friend or family member to drive you. Let emergency responders take over. Your safety is what matters most. Now that you know when to get help, let's talk about what you can do at home to stop a nosebleed fast. Most nosebleeds can be treated right in your own home. And here's the simple, step-by-step way to do it. First, blow your nose gently. Yes, it might make the bleeding get worse for a moment, and that's completely okay. You're just clearing out any clots so you can start fresh. Next, sit or stand up, leaning slightly forward. This helps the blood drain out of your nose, not down your throat. Do not lie down or tilt your head back. Tilting back can cause blood to run down your throat, which can be dangerous or make you feel sick. Now for the most important step. Pinch the soft part of your nose, right below the bony bridge, not the bridge itself. Even if the bleeding seems to come from only one side, pinch both sides together. This pressure helps stop the bleeding by pressing the blood vessels closed. Keep applying steady, firm pressure for a full 15 minutes if you're an adult. For children, 5 minutes is enough to start with. Use a clock or timer. And here's a key tip. Don't keep peeking to check if it's stopped before the time is up. If you do, you might actually restart the bleeding. If the bleeding still hasn't stopped after your first try, don't panic. Repeat these exact steps again. Another 15 minutes of steady pressure for adults, or 5 minutes for kids. In total, you'll be applying pressure for up to 30 minutes for adults or 10 minutes for children. If after all this, the bleeding still won't stop, it's time to see a doctor or go to the emergency room or urgent care clinic for help. Remember, staying calm and following these steps can stop most nosebleeds quickly, so you can get back to your day worry-free. Okay, say you've had a nosebleed, or maybe two. But what if it keeps happening over and over again? If you're getting frequent nosebleeds, it's time to pay closer attention. Here are some of the most common causes, and what to watch out for. First, the environment. Dry air is one of the biggest culprits, especially in the winter or in heated indoor spaces. When the air is too dry, the lining inside your nose can crack and bleed more easily. Another cause, overusing nasal sprays, especially those meant for colds or allergies. Using these sprays too often can actually irritate and damage the inside of your nose, making bleeding more likely. Are you catching colds frequently? Chronic colds or respiratory infections can inflame the nasal passages and lead to repeated bleeding. And here's a serious one. Using drugs like cocaine that are snorted through the nose can severely damage the nasal lining, leading to persistent nosebleeds and even long-term complications. But sometimes, frequent nosebleeds are a sign of something deeper going on in your body. You could have a clotting problem, meaning your blood doesn't stop bleeding as it should. This can be part of a medical condition that affects how your blood forms clots. A big clue: if you notice that you bruise easily or bleed more than expected from small cuts or scrapes, that's worth discussing with a healthcare provider. Here's the bottom line. If you're getting nosebleeds often, and you're doing everything right, it could be more than just dry air. Talk to your doctor. They can help you figure out what's really going on, and whether further testing or treatment is needed. So, what happens if your nosebleed just won't stop, and you need to see a doctor or nurse? Here's what to expect. And don't worry, it's usually a quick and simple process. First, your healthcare provider will check to make sure you're breathing comfortably. This is their top priority. They'll make sure your airway is clear and that you're stable. Next, they'll focus on stopping the bleeding as quickly and safely as possible. To do that, they may use a few different treatments, and they're all designed to work fast and minimize discomfort. One common method is nasal packing. This involves placing a soft material, like gauze or a special sponge, gently inside your nose. The pressure helps control the bleeding and gives the blood vessels time to seal up. Another option is a small medical device, like a balloon or absorbent pad, designed specifically to apply pressure inside the nasal passage and stop the bleeding. These procedures are usually quick, done right in the clinic or emergency room, and require little to no recovery time. And here's something important to remember. If you do need medical treatment for a nosebleed, it doesn't mean something is terribly wrong. Nosebleeds are common, and doctors treat them every day. Most of the time, it's just a precaution to help you heal safely and quickly. So if you're ever in doubt, it's always okay to seek help. Now you know exactly what to do when a nosebleed strikes. Fast, simple, and safe. If you found this helpful, give it a thumbs up, share it with friends or family who might need it, and subscribe for more easy to understand health tips every week. Don't forget to hit the bell icon so you never miss a life-saving tip. Thanks for watching, and remember, your health doesn't have to be confusing. I will see you in the next one.